Welcome to our channel. We are discussing drug-drug interactions and looking at macrolides and antipsychotics. And we are going to see how they cause ventricular tachyarrhythmias in these drug-drug interactions. So as part of our series, let's look at the therapeutic mechanism of action of macrolides and antipsychotics. Macrolides are going to be given as antibiotics. And these macrolides are protein synthesis inhibitors that target the 50th subunit ribosomal subunit. Okay, they target the ribosomal subunit 50S. By attacking the 50S, they block translocation and peptide elongation during the protein synthesis pathway. And because of that effect, macrolides are bacteriostatic in effect. That's how macrolides execute their work, therapeutic work. Antipsychotics that we are talking about, these are antipsychotics that cause QT prolongation. And these antipsychotics block dopamine D2 receptors in the mesolimbic pathway, reducing the positive symptoms in schizophrenia. Okay, they also block the 5-HT2, okay, the 5-HT2A receptors, thereby moderating mood and cognition. That's what we know from the pharmacology of these drugs. But we also know that macrolides and antipsychotics, they both block cardiac human ether ego related gene potassium channels. Okay? They attack potassium channels in the cardiac tissue that are encoded by the human ether ego related gene. Okay? By blocking that channel, those potassium channels, they cause rapid component of delayed rectifier potassium channels to stop. Okay, so when they block these potassium channels, they cause a delay in the repolarization of the cardiac potential. And because they have caused the delay in the repolarization of the cardiac potential, they lead to prolonged QT interval. This prolonged QT interval will manifest as fetal arrhythmias. Okay, so we shall have what we call dosadis dipointes, which is a fetal polymorphic ventricular tachyarrhythmia. Okay, so that's the mechanism of interaction. Okay, so let me go back a little more. I said macrolides, by therapeutic mechanism of action, they are protein synthesis inhibitors that target the 50S ribosomal subunit, blocking translocation and peptide elongation, thereby bringing about a bacteriostatic effect. That's why we give macrolides as an antibiotic. But antipsychotic agents, the examples we're about to know, block dopamine D2 receptors in a mesolimbic pathway, thereby reducing the positive symptoms in conditions like schizophrenia, and also blocks the 5-HT2A receptors, thereby moderating mood and cognition. Okay, then we said the mechanism of this interaction, when you give macrolide, when you give antipsychotics, both of these agents, they block cardiac human ether ego related potassium channels, which we call the HERG channels, okay, leading to blockage of the rapid component of delayed rectifier potassium channels, which delays the repolarization of the cardiac potential, leading to prolonged QT interval, which manifests as fetal arrhythmias. And these fetal arrhythmias are dosadis dipointes, which is a fetal polymorphic ventricular tachyarrhythmia. Okay, so what are the examples of antipsychotics that interact with macrolides? The macrolides, in the first place, we have the erythromycin, we have clarithromycin. Okay, and we know that uh, antipsychotics that cause QT prolongation are the haloperidol, ziprasidone, clozapine. Okay, they will cause QT prolongation. So these two agents, when they are given concurrently, they increase the chances of a patient falling into fatal arrhythmias. So what is the um, take home message from here? Okay, we see that it is better to avoid a combination of macrolides and antipsychotic agents that cause QT prolongation, okay, unless it is absolutely necessary. When will they be necessary? You'll have clinical scenarios, okay? Think about a patient who is having severe atypical pneumonia like the Legionella pneumonia, where alternative agents have failed to work, like your doxycycline has not worked, fluoroquinolones have not worked. You may want to give macrolides, okay? We look at pertussis, that's the whooping cough in pregnant women or infant, where other alternatives may not be available. You may want to give the macrolides, okay? Now, patients with some of these conditions may be at the same time having acute psychosis, okay, where you need to use your haloperidol as your agent. It's better in such conditions to take a second thought, okay? You may have, for example, clozapine resistant schizophrenia, and then you need to put these patients on typical agents, okay? So it is important to evaluate, okay, this patient, all right? So the most risky population with macrolide and psychotic interaction are the elderly patients, okay? Thank you very much for understanding macrolide and psychotic drug interactions. Thank you.